This is Selma Schimmel for the Group Room at the ESMO 2012 Congress happening now in Vienna. And we are joined by Dr. Gouri Shankar, Bhattacharyya, head of the Department of Medical Oncology at the Fortis Hospital and Assistant Professor of Oncology at the Chittoranda National Cancer Institute in Calcutta, India. He is also on ESMO's Developing Countries Task Force. Welcome to the Group Room.
Thank you. It's my pleasure to be here.
Who manages efforts on behalf of patient education and awareness, which is a daunting task?
The most important thing is that we from Developing Countries Task Force have an important conclusion to this issue is that education and awareness makes a lot of difference. If you can educate people, if you can get people aware for cancers, you can actually start detecting earlier, possibly even preventing cancers. Now that became very important because once you're aware that you need to change your lifestyle, you need to stop smoking, you need to have a good menstrual hygiene, you've got to have a good breast care, this happens. And this is something which developing countries successfully, the task force has been able to do in Ghana under a project called Afrox.
Let's move on now and talk about Afrox, the Africa for Oncology Care Oxford.
Afrox basically is a program which was done and set up from the Oxford University in looking at how to help the sub-Saharan population in doing cancer care or providing quality cancer care, because they came to the conclusion that it was so ridiculous that if you look at the African countries, 65% of them don't even have an access to a radiotherapy machine. Now, keeping that in background, the essential part is how to get people aware of the disease and look for it early. The entire effort started off from the Oxford University under the guidance of Professor David Kerr. And David Kerr, incidentally, is the founder and the trustee to this Afrox project. It was the full-hearted support of the Developing Countries Task Force, both financially and as well as in resources, to see this project was done. It went through quite a few major methods of handling that, including developing posters, which are circulated among the Developing Task Force to make them more appropriate, which looks like the whole issue came from the entire African Ghana area where this is being done. It was their problem which had to be bought. It was like teaching mothers through those posters how to recognize a child with early retinoblastoma, how to recognize a lump in the abdomen or in the neck. Or for that matter of fact, it was also like telling you and warning you about smoking. It was also like telling you how to detect early cancers of the breast. So that became very, very important, that getting Ghana aware that beside your other problems of infected disease, your AIDS, your malaria, your tuberculosis, you have another major problem which is looming all over you, and that's cancer. This Ghana thing has been an extremely successful model. And it was such a successful model that the Developing Countries Task Force put this up as on YouTube also through the ESMO, which is accessible in the YouTube. They also brought out a kit, which is called the slide kit for training people and for trainers who can apply this in other developing countries to see adapting them how it happens. That is the beauty of this project which has been done. It's a low resource, apt, down to earth, designed for the individual place, where there is no situation that I'm superior, I lay my call, but making it feel that's come from the grounds of Ghana in which they did it. I mean, I'm not carrying it, but I'm sure if one would go into the YouTube and check it, you would see what excellent amount of material there's there on that.
Based on the success of the Afrox project, are there other models taking after the Africa for Oncology Care Oxford program that are being implemented for some of the other regions?
Afrox itself is moving out of Ghana. It's staying in Ghana, but also spreading its tentacles into the rest of the Africa to make it more successful. They are getting into other parts. Then we have the most important thing is that Developing Countries Task Force has joined hands in Georgia to develop guidelines for breast cancers in Georgia, along with the care for there. We also have an important thing that's come up that Developing Countries Task Force is trying to look into certain Eastern Europe areas based on this model. Offshoot of this model also has been attempted at India with a unique partnership basically, which has been just brought up by the Developing Countries Task Force as a model for lung cancer, which has been a partnership to show that we can have a win-win situation where all stakeholders can come together to get aware of a disease.
So we could probably go on talking and talking and talking. It's been a fascinating interview with you. Dr. Gouri Shankar, thank you very much.
Thank you, ma'am. Thank you, everybody.